is visible. Everyone is muted, so I'm the only one who can speak.
No problem, no problem.
Please go on, Dr. Odufuwa.
Okay. So I was explaining what the prostate is, and prostate the prostate lies just below the bladder, and I hope my arrow is very visible so that I could take everyone along as I'm explaining it. So the prostate is this organ just below the bladder, and within the prostate goes a tube that carries urine from the bladder through the penis, then the urine comes out. So if there is anything going on with the prostate, it's going to affect the movement of urine from the bladder through the tube out to the exterior, and as a result of that, urine could get blocked, and an individual with any problem with the prostate could have difficulty with passing urine. So what is the function of the prostate? The prostate's main function is to make fluid for semen, and it is essential for a man's fertility. So if there is anything going wrong with the prostate, it could affect the flow of urine and also could affect the fertility of a man. So the prostate itself provides the fluid that is seen in semen, and that semen is used in providing, it's used in the male reproductive organ to procreate, and all. So what is benign prostatic hyperplasia? Benign prostatic hyperplasia is when the prostate and the surrounding tissues expand. As one ages, the prostate may become large, and BPH occurs when it is large enough to cause problem. As the prostate enlarges, it presses against the urethra, which was the tube I explained earlier, and can cause many urinary symptoms. Now, my arrow is pointing towards a normal male reproductive organ where this bladder is above the prostate. This is the normal prostate size, just like the size of a walnut. So beside it shows the enlarged prostate. And we can see how narrow the tube has become due to this enlarged prostate as compared to normal prostates, where this tube is free and as such urine can pass through it, and any individual with a normal prostate will be able to urinate freely. But because of the enlarged prostate, it compresses on that tube, which I explained earlier. The tube is called the urethra, and because of that, the person will have urinary symptoms, problems with passing urine. So go to the next slide. The epidemiology of this condition, the benign prostatic hyperplasia. The overall prevalence of this condition was 237 per 1,000 men, and the age-specific prevalence rate increased from 104 per 1,000 men in the 5th decade to 429 per 1,000 men in men greater than 90 years. And the burden of this condition is very high amongst Nigerian men, and the prevalence increases with age. So the prevalence of BPH increases with age. So the tendency to come down with this condition increases with as one becomes as one grows. So who are people that are at risk of this condition? Number one, we have men over the age of 50 years. like I said earlier, the risk increases with age. So men who are 50 years have tendency to come down with this condition. And it is usually advisable that once an individual clocks 50, 55, it's best to start screening to ensure this doesn't happen. And if it's there, we curb it on time and start treatment immediately. Also, men who have family history of this condition. For example, let's say a man has a father who had suffered from this condition, or suffered a cancer, or suffered a prostate cancer, or suffered this exact condition. There is a tendency that that man would also come down with this condition. So it's hereditary. It's hereditary. And other risk factors include men who have medical conditions like obesity, heart disease, and type 2 diabetics. Some men with erectile dysfunction too can also have this condition. And men who lack physical exercise. So exercise is good for the body, and it helps in reducing the risk of coming down with this condition. So what is the cause of this BPH, of this condition? Medically speaking, the causes of BPH are unclear, and we just follow the risk factors, and we've come to realize that it occurs in older men, and hormonal changes play a role. There is this hormone called dihydrotestosterone, which is found in men. This hormone supports the growth of these prostates. And studies have shown that older men, they have higher levels of this hormone. So there are studies that have linked the cause of this condition to this hormone. So how do people with this condition present? What are the things they go through? What are the signs they see in their body, and they suspect that this is something that is going on with them? When the prostate is enlarged, it can block the bladder, like I explained earlier. Once the bladder is blocked, or once that tube is blocked, the need to pass urine is often a common symptom of this condition. So men with this condition, they come down with a weak urine flow. Remember, children, when a child urinates, a male child urinates, the flow is so strong that it can burrow through a heap of sand. But a man with this condition might not be able to have that energy or that flow to burrow through a heap of sand. So that man would experience a weak urine flow as compared to the child. So another symptom could be hesitancy. When the individual wants to ease himself in the toilet, he finds it difficult to start urinating because of that obstruction. And another symptom is intermittency. The need to stop and start several times when passing urine. So the person could be in the toilet for a while, the urine will come out, it will stop, it will come out, it will stop, it will come out till it's completely removed from the bladder. And sometimes again, the need to push or strain to pass urine is seen. That is called straining. Then another symptom that could occur is the feeling of the urgency to go pass urine. That means if a man with this condition is pressed and he needs to pass urine, he needs to go immediately. If not, he might soil himself. So I'll be showing you diagrams of this condition, symptoms I just explained. And also there are other symptoms, the frequency. That means there is increased urination. The person needs to go to the toilet frequently. Within 1 hour, 2 hours, the man is already pressed. He needs to urinate. He needs to ease himself. And sometimes at night, the person might wake up more than twice to urinate. And another symptom called incomplete emptying. The person feels, or the individual feels, the bladder is full even after passing urine. So these are pictures showing the symptoms that I just explained. So this first man shows the weak urine stream. Usually, if a child is urinating or just someone in the average age, the urine should flow faster than this, and even the stream should be powerful than this. But someone with this condition has a weak urine stream, urine flow, and the frequency to go to the toilet is much shown in this picture. And the urge to urinate is always there, and frequent urination during the night. So these pictures really explains the symptoms someone goes through if the person is experiencing this condition. Now, how do we make a diagnosis of this condition? If a man has any urinary changes, he should see the doctor. If he notice anything going on with the urine, once you're above 40 or 50 and you notice that your urine is not coming out as as before, it comes and stops, you're having difficulty starting urine, please see a doctor immediately, and you'll be examined and know what exactly the problem is. So if you see a doctor, the doctor will talk to you about the symptoms and try to grade it, because there is the mild, there is the moderate, and there is severe, the severity of this condition. And this is based on the symptoms that you are presenting with. Also, the doctor can do an examination on you, and we call that examination digital rectal examination. I'll be showing you a picture right about now. So that involves going through your anus. The doctor puts his hand through your anus so as to feel for that prostate. So he feels the prostate, he sees the size, he finds out if it's large or if there is anything going on with it. And we are able to at least suspect a particular condition going on with the prostate through this examination. Other tests that could be done, the doctor will do a urine test, and another test which is very, very important, and I will emphasize this test in this meeting today. And the test is the prostate specific antigen. They call it PSA. It is very important that a man above 55 years should know his PSA level, and also probably yearly or twice or after 3 years, keep checking and checking so as to monitor it, because this prostate specific antigen, it is a chemical that is produced in the prostate, and if it is high, it gives us a suspicion of something going on with the prostate. So the more the earlier we notice it, the better for us to manage and curb anything that could arise, or any disease that could arise from this prostate. So it is advisable that we go for PSA, men go for PSA screening, and know PSA level. So other things that could be done to identify this condition is also scan. They could do a tummy abdominal scan, that's a tummy scan, to see the organs in the body where the prostate too might also be visualized, and we'll be able to know if there's anything going on with it. So how do we treat this condition? There are many treatments for BPH, and it depends on the level of the symptoms. Like I said, if it's just a mild symptom or a mild to moderate symptom, we could just do an active surveillance, meaning that we may not treat, we'll just keep watching to see if there will be any progression. There are some people that may not need treatment. However, most people might need treatment, and there are other ways that they could be treated medically and surgically. So medically, they will be given drugs. The drugs is to prevent the increase in the prostate, in the enlargement, like the prostate is enlarged. So we're trying to prevent more increase. And also the other drug, this other drug, that is the alpha blocker, is to relax the prostate and the bladder so that urine could come out freely. There are other methods, like I've explained, surgically, that can be done. In a surgical, with the surgical method, they remove the prostate, and that is usually done for severe cases in which drugs cannot cure. So we will be going to the complication of this condition. For every disease, there are complications. So the first complication is acute urinary retention. What do I mean by acute urinary retention? In acute urinary retention, there is, since the tube that takes urine out of the bladder is blocked, there is difficulty in passing urine. This picture, this normal, see my arrow, normal flow and restricted flow. Now, in a normal flow, it's easy to pass urine from the bladder out to the exterior. But in restricted flow, it's seen in this condition, the prostate hinges on the urethra, that's you, and as such, there is difficulty in passing urine. So such individual with this condition will have difficulty in passing urine. And sometimes we see some people using catheter, sometimes they call it rubber, and that catheter, that rubber, they pass it through the penis so as to relieve this condition. So other things that could arise is infection, urinary tract infection. Urine should not be stored for long, and someone with BPH has the tendency to store urine for long within the bladder, and that would give room for bugs, infections to set in, and the person is coming down with infection. And that could lead to the bladder damage, and could also affect the kidneys. So it is very important to take, once this symptom is noticed, it's best to go to the hospital immediately to prevent complications like this. So how do we prevent this condition? There is actually no sure way to prevent this condition, but research has shown having a good lifestyle plan could help. Not losing weight, ensuring that you engage in exercises regularly, eating well-balanced diet, eating food rich in fruits and vegetables could reduce the risk. So we're going to the second type of disease that could arise from the prostate, which is the prostate cancer. This is the most scary of them all. Like I said earlier, cancer is the result of abnormal growth, which can take over the body's normal cell function, making it hard for the body to work the way it should. Prostate cancer develops when there is abnormal cell formed and also growing in the prostate gland. This cancerous growth can spread to different organs of the body and could affect the functioning of the individual. So I'm going to be showing a picture showing you a prostate cancer. So this is a normal prostate. This is a normal prostate. Normal prostate, like I've shown earlier. Then this is someone with a cancer within the prostate. And the cancer too can also press on the tube that carries urine out and also prevents the urine flow. Number one cancer in Nigerian men, and it constitutes 11% of all male cancers. So about 6 in 10 prostate cancers are diagnosed in men who are 65 years or older, and is rare in men under 40 years. Prostate cancer risk is also higher in African American men, in Caribbean men, and of the African ancestors than in men of other races. So it's mostly seen in Black men. So there are different stages, just like any other cancer of the body. There are stages: the early stage, the locally advanced stage, and the advanced stage. For the early stage, that means cancer is just newly diagnosed or newly discovered, and is still found, like I showed earlier, the picture I showed earlier, is still found within the prostate. But when it is locally advanced, it has spread from the prostate to affect the surrounding structures like the bladder and the organs around the prostate. And when it is advanced, when it has gotten to the advanced stage, it could spread anywhere. It could go to the lungs, causing difficulty with breathing. It could go to the brain. It could go to the liver. It could go to the back, the spine, and cause backache. So usually, men that have backaches, it's best to also check your prostate-specific antigen. That PSA, it's best to check it because the backache may not necessarily be coming from the back. It may also be from as a result of something going on with the prostate itself. So what are the symptoms of prostate cancer? In addition to the initial symptoms that I explained, people with prostate cancer in early stages, prostate cancers usually might not have any symptoms. But when the symptom occurs, they look like the symptoms like I've explained earlier: difficulty with passing urine, the frequency, the urgency, the existence. And in addition to that, you can see blood in the urine, and also the symptoms of cancers would also be reviewed, like weight loss, loss of appetite, bone pain, low back pain, hips pain, upper thigh pain. So any pain unusual in the body of a man older than 55 years is something to be worried about, and we need to go to the hospital to get screened for prostate conditions. So what are the risk factors? Like I said earlier, the age is a risk factor. Men greater than 55 years of age should have their screening done so as to check if there is any condition going on with the prostate. Then family history, someone with probably a man who has a father or a grandfather that had prostate cancer, there is a risk of him also coming down with prostate cancer. And it's best to also do screening. Then also weight, obesity too would be a risk factor. So how do we diagnose prostate cancer? PSA is a very important test to make a diagnosis of prostate cancer. The higher it becomes, the more worried we should be, and ensure treatment is started as soon as possible. Then the doctor can, once an individual is having, or a man is having the symptoms, we could go in through the anus and pick some tissues from this prostate and go and study it to find out if they are cancerous or they are non-cancerous. Then imaging tests, the scans could also be done to check other organs if they have been affected. So how do we treat a man with prostate cancer? Treatment depends on the stage and the overall health of the individual. So the earlier we discover it, the better for the individual. And for the early stage cancer, the best is to do a surgery to take the prostate out, and other form of therapy like radiation therapy. Sometimes for locally advanced, we could do some form of hormonal manipulation to reduce the level of that, using some hormones, using some drugs to reduce the level of that hormones that I mentioned initially that could increase the risk of this condition. So if we reduce the level of the hormones, if we take out the testosterone, reduce all the male reproductive organ hormones, there could be side effects such as impotence, loss of libido, and breast enlargement in males. So the screening for prostate cancer. Once a man is above 50, 55, get your PSA checks, get your PSA done as soon as possible. And if there is a positive family history, it's good to know about our family history. If there's anyone that has died from this condition or that is currently being affected, uncles, grandfathers, fathers, we should start screening as early as 40 years of age. This image is showing that recent research has shown that deaths from prostate cancer has decreased by 30% since this PSA test became available. And the early diagnosis can help catch the cancer before it becomes life-threatening or causes serious problems. Men 55 to 69 years should make individual decisions about being screened for prostate cancer with a PSA test. In conclusion, BPH, that's the benign prostatic hyperplasia, is one of the commonest urological conditions seen in men over 40 years. And it can sometimes coexist with the cancer. Prompt management of its presentation and definitive treatment is important in reducing the morbidity and mortality from this disease. Thank you very much. And these are my references.
Thank you very much, Dr. Odufuwa, for the very brief presentation and very explanatory. Let me start by apologizing for the bit of challenge we had at the commencement of this program. It was due to technical glitches from this end, coupled with our gen not coming up. I apologize. We've had it all from Dr. Odufuwa. I have picked few things, and the major things I've learned is that prostate diseases is common among African men and the Caribbeans. And the fact that if we have the history of prostate diseases within the family, then we need to start the screening by age 40.
Yes.
Otherwise, for prostate enlargement, at 55 years, we should commence doing the test, the PSA test, she called it. We should know our PSA level. And for the cancer, from age 65, it is compulsory for us to start doing our PSA test regularly to understand our status and to do all that we need to do to manage the health condition. I'm sure a lot of us have questions, which some have already typed on the chat. At this time, I'm going to give us opportunity to start asking our questions for the next 10 to 15 minutes before the head of service will declare the program closed. So if you have any question, you can please signify, and then you will be asked. Okay? I think we already have someone signifying. Mr. Agbesonwa.